My name is Katie Aldridge, and I am a nurse at Mississippi University for Women, and I'm going to give my presentation today. I've got 5 registered nurses here with me. This is Marley. She works in the MICU. This is Madison. She also works in the MICU. This is Will. He works in the MICU, and Hunter also works in the MICU. And then we have Miss Sybil, who's a registered nurse as well. Okay. We're going to talk about the opioid crisis in the United States today. So our objectives for this PowerPoint is, by the end of the presentation, y'all will be able to define the national opioid crisis, explain the effects of the opioid crisis on the healthcare industry, recognize signs and symptoms of opioid abuse, identify ways to combat the opioid crisis, and describe methods on how to make a difference in the future. So what exactly is the opioid crisis? The overuse or misuse of opioids that has resulted in an increased amount of addiction and overdose in the United States. It started in 1990 with the pharmaceutical companies who convinced the medical community that opioids were not addictive, but they really were, and it caused a lot of problems afterward. Too many opioids prescribed by physicians to the public happened before they realized how addictive they actually were. And so the problem grew to the point that President Trump has actually declared it a national emergency in the United States. Overdoses are not the only problem caused by these drugs. Increased incidences of hepatitis C from IV drug use and neonatal diseases are more prominent since this problem has arisen. For every fatal overdose, there's a surprising amount of non-fatal overdoses that occur as well. Here's some statistics. These are all according to the CDC. From 1999 to 2017, almost 400,000 people died from an overdose involving any opioid, including prescription and illicit opioids. On average, 130 Americans die every day from an opioid overdose. Around 30% of patients who are prescribed opioids for chronic pain misuse them. So how is healthcare affected by the opioid crisis? Well, first off, decreased patient satisfaction. Patients relate their level of discomfort to how well they're being treated in the hospital. If they're hurting, they give a bad review on the hospital. And even worse, that hospital's reimbursements are relying on their surveys that are not accurately displaying how well they're cared for. There's an instant gratification attitude in the world that we live in today. People don't like to be uncomfortable. There's been a major lack of education with the general population about pain and illness and the relation to surgery. Throwing pain medication at somebody might make the pain go away for a short period of time, but focus should be given on the cause of the problem in order to treat their pain. Pharmaceutical companies' profits actually suffer here. The overprescribing of opioids has hurt financial gains for pharmaceutical companies. At this point, even if a physician will not prescribe opioids, it's not hard for people to find a dealer who will sell drugs to them. The overprescribing of these drugs to the lower class community has caused them to realize how valuable these medications are instead of taking them for their intended prescribed use. They won't take them, they will sell them easily because of the high demand. And new attitudes toward chronic pain. In the past, chronic pain was just largely treated with non-pharmacological methods like cognitive and behavioral therapies. In 1990, there seemed to be a spike in patient population that complained of chronic pain because of a number of factors. People were just getting older, they had more muscle aches, they were obese, people were surviving illnesses like cancer a lot more frequently. The popular opinion became that chronic pain was undertreated, so the opioids used to treat acute pain on a short-term basis in the past became the new normal for chronic pain therapies. Ultimately, there came a time where patients expected to be pain-free because of how effective the opioids were, and they still feel that way today. Little did they know the detrimental effects that would follow. Here's some signs and symptoms of opioid abuse, and this is in the lay community and in healthcare workers. In healthcare workers, you have absenteeism, they just don't show up for work, longer breaks, altered work performance, they're just not as efficient on their jobs anymore. Increased wastage of drugs, you see wasting narcotics a lot more frequently than usual. And again, inappropriate narcotic dosages by physicians, personal and professional isolation. In lay people, you see that they're seeking the same prescription from multiple physicians, borrowing or losing medications, taking drugs just in case, even if they're not hurting, they just have an extra one laying around and they go on and take it just in case. Mood changes, sleep pattern alterations, and poor decision making. So how can we combat the opioid crisis? So there's 5 priorities that the U.S. Department of Health and Human Services has come out with, and we're going to talk about those. Number 1 is to improve access to treatment and recovery services. 90% of Americans that are struggling with addiction are not getting treatment. DHHS sent letters to all 50 states governors announcing that $485 million in grants would be given towards evidence-based prevention and treatment activities. Number 2, promote use of overdose reversing drugs. This is your Narcan. The approved uses of drugs like Narcan have brought thousands of people back from the near dead after unintentional or intentional overdoses. State-based grants have been given for the purpose of making these life-saving drugs affordable and easily accessible. The DHHS, FDA, CMS, and NIH are all committed to this cause. Strengthen understanding through better public health surveillance. Law enforcement and public health authorities play a large role here. Communication between members of the community about how situations are and how they're experiencing them in the field allows for information to travel up the chain of command. It starts with the local authorities and moves up to the state and national government officials that can share this information with the CDC, who is ultimately responsible for the nation's public health. Provide support for cutting-edge resource on pain and pain addiction. The scientists at the CDC, in conjunction with the scientists at the National Institute of Drug Abuse, are working diligently with grant money to develop more effective pharmacological and non-pharmacological methods of pain management. They're also questioning the possibility of a vaccine for opioid addiction. Advance better practices for pain management. In the 1990s, attitudes about pain changed. Again, physicians became overeager to treat pain with opioids, and the idea that pain is the 5th vital sign came to light. Secretary Price said it best, a symptom of disease is not a vital sign. Increased patient satisfaction is highly related to an absence of pain, and sometimes this is frankly not possible. There's been a lack of education on the idea that all pain can and will be eliminated. So what does the opioid, what does the future hold for the opioid crisis? Safe prescribing saves lives. Basically, the CDC has published these guidelines, specific guidelines for prescribing opioids for chronic pain, and this is kind of their motto. Healthcare professionals, in order to educate them in the proper way to administer safe but effective chronic pain treatment, while also limiting misuse and overdose. Hopefully more and more practitioners will follow these guidelines and significantly decrease the number of people being affected by the opioid crisis in the future. And this is the HEAL initiative, helping to end addiction long-term in 2018. It's a recently developed research initiative created by the NIH. Its purpose is to provide scientific solutions to the opioid crisis and offer a new hope to those that have been involved. This plan specifically targets researching ways to prevent and treat opioid misuse, as well as enhancing pain management. That's all I got. Thank y'all.